Good evening and welcome to tonight's health segment. Malaria, a deadly disease caused by Plasmodium parasite, continues to pose a major challenges in many parts of the world. However, advancement in treatment are providing hope and saving lives. Let's take a closer look at the key approaches to managing this disease.
Let's start with the treatment for uncomplicated malaria. The first-line approach is the use of artemisinin-based combination therapies, or ACTs. These combinations, such as artemether, lumefantrine, and artesunate amiodarone, are highly effective at eliminating the parasite from the bloodstream. In regions where drug resistance isn't an issue, chloroquine remains a reliable treatment, especially for infection caused by Plasmodium vivax and also Plasmodium ovale. But malaria can quickly turn severe, and in such cases, immediate intervention is critical. The recommended treatment for severe malaria is intravenous artesunate. This life-saving drug is administered in hospital, and once the patient's condition improves, they are transitioned to a full course of oral ACTs to ensure complete recovery. Now, there are special considerations for certain groups, such as pregnant women. During the first trimester, the treatment options include quinine and clindamycin, which are safe for both the mother and baby. In the second and third trimester, ACTs are the preferred choice, offering a safe and effective option. For infection caused by Plasmodium vivax or Plasmodium ovale, there's an added challenge. These parasites can remain dormant in the liver and cause relapses. To address this, drugs like primaquine or tafenoquine are used to eliminate these dormant forms, but it's essential to test for G6PD deficiency beforehand to avoid a complication.
Treatment plays a vital role in saving lives, but prevention is just as important, especially in high-risk areas. To tell us more about how we can protect ourselves and stop the spread of malaria, let's go to Muhammad Fakhrullah. Fakhrullah, over to you.
Thank you, HUZAIFAH. Now, I will talk about malaria prevention and vector control. First, let's discuss prophylactic drugs. These medications are crucial for travelers heading to malaria-prone regions. Common options include doxycycline and mefloquine. It's essential to consult with a healthcare provider to determine the best choice based on your specific travel plans and health history. Okay, so taking this medication can significantly reduce your risk of contracting malaria while you're away. Next, let's move on to insect bite prevention. This is another key strategy in avoiding malaria. Here are some effective measures you can take. First, consider using insecticide treat bed nets, ITNs, whenever you sleep. These nets provide a protective barrier against mosquitoes. You might also want to look into long-lasting insecticide nets, LLINs, which offer extended protection. So don't forget to apply mosquito repellent containing DEET or other effective ingredient to exposed skins, particularly during the evening when mosquitoes are most active. Wearing protecting clothes such as long sleeve shirts and pants can also help keep those pesky insects at bay. Now, let's talk about vector control, which is the second part, which plays a vital role in reducing mosquito population. There are two primary methods. Indoor residual spraying IRS involves spraying insecticide on walls and ceiling of homes to kill mosquitoes that rest there. These methods can significantly decrease the number of mosquitoes indoors. The second method is larva source management, which focuses on eliminating mosquito breeding sites by draining stagnant water where mosquitoes lay their eggs. By reducing this breeding ground, we can prevent new mosquitoes from emerging. Both of these vector control strategy can be highly effective when implemented correctly. For example, RS can dramatically lower the number of mosquitoes in homes while managing breeding sites helps stop new population from developing. Okay, now so I pass to Muhammad.
Thank you, Fakhrullah. Malaria remains a significant global health challenge, particularly in endemic regions. Various strategies are being employed to eradicate this disease, including vaccination, mass drug administration, and enhanced surveillance and monitoring. First, vaccination. The RTS-SAS01 mosquito vaccine represents a landmark development in malaria prevention. Approved by the World Health Organization WHO in 2021 for children in endemic areas. This vaccine clinical trials demonstrating its safety and efficacy. In trial involving over 15,000 participants across several African countries, This vaccine show approximately 36% effectiveness in preventing severe malaria among children aged 5 to 17 months. However, its effectiveness is notably lower in infant aged 6 to 12 weeks, primarily due to their immature immune system. Thus, ongoing research aims to develop next-generation malaria vaccines. Grants from the Bill and Melinda Gates Foundation have been awarded to explore innovative vaccine strategies by identifying specific malaria proteins that elicit strong immune response. This research could lead to more effective vaccine tailored for diverse population. Second, mass drug administration involve administering anti-malaria drugs to entire population, regardless of individual infection status. These strategies aim to clear existing infection and interrupt transmission. The effectiveness of MDA can significantly reduce malaria prevalence shortly after implementation. For instance, studies show a rapid decrease in parasitemia prevalence following MDA interventions. However, the long-term effectiveness varies based on local transmission dynamics and the timing of MDA relative to peak malaria season. In high transmission areas, the benefit may be transient due to the potential for reintroduction of malaria from surrounding regions. Lastly, effective surveillance is crucial for malaria eradication effort, enabling rapid response to outbreak and monitoring resistant patterns. Enhanced diagnostic capability allow for quicker identification and treatment of malaria cases, which is vital for limiting transmission techniques such as polymerase chain reaction (PCR) and increasingly used in the endemic areas to improve diagnostic accuracy. That's all for me. I pass back to the HUZAIFAH. Thank you.
Thank you, Mohammed, for that insightful report. We'll continue to monitor development on this issue. And that wraps up this segment. Stay tuned, there's more ahead on Biotech Chat.